very happy that you are going to be a part of our Future Falcons webinar series today, and that you're taking an opportunity to learn more about your state college. Today we are happy to have Dr. Colin Chesley. He is the Associate Vice President for our College of Health and Public Services, and he will be discussing some of our health careers. So the format of today's presentation is that he's going to go through his presentation, and then afterwards we will open it up for question and answers. Just for housekeeping measures, I want to let you know that this webinar is being recorded. And so at this point, I'm going to turn things over to Dr. Colin Chesley.
All right, thank you very much. Hello, ladies and gentlemen. Welcome today. Thank you all for taking the time to join us and to talk about the health programs here at Daytona State College. This is definitely a landmark time to be looking at health, careers in health professions. These are the just necessary folks that we've got right now that are working, and this is an exciting career, and this is an exciting time to be joining this. So, welcome. What I want to do today is I want to tell you about the college in general, and I want to tell you about the various health careers that we have here in the college. And I'm also going to use some data from the Bureau of Labor Statistics just to give you some ideas of what the job outlook is like for these careers. And I want to show you some of their videos. They actually have some pretty good videos. They're only about a minute and a half piece. If they work, I'd like to show those to you. If for some reason they don't work, or if there's a specific career that you want to see that I don't mention, please Google the U.S. Department of Labor Statistics or the Bureau of Labor Statistics, and you'll just input whatever career you're looking for, and there's a great page on any of these. So to begin with, I want to show you we have within our college 4 schools. So we have the School of Nursing, the School of Health Careers, the School of Dental Sciences, and the School of Emergency Services. And within each one of these are various programs that I would like to take you all through. All right, to begin with, the School of Nursing. This one's obviously self-explanatory and is very crucial right now. So there's a couple of reasons. Why would you want to be a nurse right now? Well, it's definitely a career in demand. It's definitely something that will help you to grow as an individual. You'll have the opportunity to work in a variety of environments and make a difference every day. And that's what actually drove me into healthcare to begin with, was I wanted to do something that was meaningful every day and that allowed me to better people's lives and to make a positive impact and get paid for it. And that's what healthcare does. It gives you that opportunity and that option to do that. So within nursing, so we've got a couple of programs within nursing that I want to share with you, and then I'll get into these statistics. We've got the associate's degree in nursing, which the ADN, and that is for a registered nurse, and that's what we're seeing right here on the screen. We also have a licensed practical nurse program. And then we also have a bachelor's degree in nursing for a BSN, which is completely online. So to begin with, just to show you some of the Bureau of Labor Statistics information here, you can see this same format is what I'll show you throughout this presentation. So you can see the 2018 median pay, about $71,000 a year. That's a median pay. It says here that the entry level is a bachelor's degree. I don't know really why it says that. The entry level for an RN is a 2-year ADN program. And then obviously it goes on from there. I would say that on average, most of our folks end up around $50,000 a year to begin with, which is not bad for 2 years of school, especially. And you'll see that throughout this presentation. The compensation is quite healthy. So what I would like to show you next is a video on nursing. Let me see if this will come through. Doesn't look like it's going to let me do it. And that's okay. Even if it doesn't, go to the website and view each one of these videos. It's really good because it allows you to see what each program offers, and it gives you a visual of what each one would be like. So here's our programs within the College of Nursing. I mentioned the practical nursing program, the LPN program. We have a transition if you have an EMS degree, or you have or if you're a respiratory therapist, or you're an LPN already, we have a program where you can transition to an RM program, and then we have the RN and the BSN program as well. Next is our School of Health Careers. Now, within Health Careers, there are several programs that I'm going to go through. So each of these, and as you can see now, I'm going to go through each one of these. Now, again, I wanted you all to see the video on this. That's okay that it's not working here. I want you, if you would, please go back and view the videos, because they'll give you that visual to see what it's actually like to work in that program. We have early childhood education, health information technology, occupational therapy assistant, physical therapy assistant, opticianry, radiography, respiratory care, surgical technology, and within the next couple of years, we're going to have sonography. And we also have a few career technical certificates as well: medical coder, builder, massage therapy, medical assistant, and phlebotomy. And I will talk about each one of these briefly. Early childhood education is not necessarily a health program, and there's a couple of these that are not health related. I'm just going to just go by these quickly. This is if you want to work in a early childhood care center. It's health related, although it's not what you typically see in a hospital setting. Dealing with childhood development careers, it's working in development centers, being a manager in that setting. That's where you would see some of those things. Now, health information technology is an interesting one that is often not very well understood. It's really our only administrative health career that we have that's not purely clinical, although this has a clinical component to it. Health careers, health information technology, is where the professionals go through and review medical records for accuracy. They're part of the revenue billing cycle, the mid cycle is what they call it, where they're ensuring that what was clinically documented is accurate, and that's reflected accurately on a billing statement. So folks that work in this are reviewing medical records, they're reviewing charts. Sometimes they work with legal counsel to obtain medical records. But these folks also have to be pretty versed in clinical components as well. So while they're not administering hands-on care like nursing or some of the others, they are clinically focused, but they're doing an administrative component of that. And so this is the job outlook for these folks. Median pay for about $40,000 a year. Post-secondary. Now, this differs as well. In Florida, to work in coding and billing, you have to have the certificate. And if you want to work in a hospital setting, which, by the way, this is a department, medical records or health information management or health information technology. These are departments within the hospital settings or in long-term care. If you want to work in that setting, the AS degree is required to get into that. Now, and I forgot to mention this with nursing, but look, nursing was 12%. Notice that this is 11%. I wanted you to see the job growth potential for each of these. So these are pretty safe careers to get into. Not only do they compensate well, they also have there's a lot of job growth, both within Volusia and Flagler County and even beyond. So, with a few years of schooling, you have a great opportunity to get into a field that pays well and has a lot of growth potential. That's the wonderful thing about healthcare that I meant to mention. Healthcare gives you the option to start in one of these professions, but you can always go on and try something else out. Let's say you get into nursing and you realize that there's some components about that maybe you don't like as well. Well, maybe you don't like working in the surgical unit, but you want to go into the ICU or the ED. You can move around to different departments. When you get into health information management, maybe you decide you want to be in a clinical setting with a few. That gets your foot into the door. That gets you that health experience. You're never just siloed into one of these positions. You can grow into many, many directions. And that was one thing that I loved about healthcare. It was so different. It was so dynamic. And I got the chance to do all kinds of different things and go into all kinds of different directions. I never got bored. It was phenomenal. Opticianry. This is a new program within the college. This is we have a fantastic lab here on the main campus. This program is all about, offers didactic, which means lecture and in classroom, and clinical training to how to use equipment to fit people with eyeglasses. They're able to use to take prescriptions, and they're able to, these are the folks that you see working in lens crafters or in the Walmart eyeglassware. And this program is is new and is doing quite well. You can see the average median pay is about the same as you'd see with health information management. 7% still faster than average job growth. And again, if you want to see more about what this is, please check out the the Bureau of Labor Statistics videos on this. Next, we have occupational therapy assistants. Now, we have a couple of therapy options here at the college. Now, when you think of therapy, for the most part, we think of typically physical therapy, occupational therapy, speech therapy, and respiratory therapy as well. Occupational therapy deals primarily with those activities of daily living that folks need to be able to get back to a full functional capacity. So you think about a geriatric patient who's had some kind of injury, maybe they had a fall with a hip fracture. This is any kind of orthopedic surgery like that is dangerous, and it's quite a surgery. It's a major surgery for those patients, especially if they're advanced in years. So when they're discharged from the hospital doesn't want to keep folks very long. The hospital is incentivized to try to treat the patients as quickly as they can and discharge them to a subacute setting, because the hospital is only paid a certain amount whether that patient is there for 3 days or 30 days. So they're counting on these subacute providers to really get in and help the patient and get them back to full functional capacity. Occupational therapy is focused on taking the example of that geriatric patient who had the hip surgery and working with them on those activities of daily living. That means showering, dressing, bathing, eating, toileting, all of those things that we do every day and take for granted. If I smack my finger when I'm nailing something, and I never think about how much I really use that finger until it's hurting. It's the same thing with occupational therapy. You don't realize we take for granted all of these activities of daily living. And so this branch of therapy is focused primarily on getting those folks back used to doing those things, doing their own dishes, doing their own laundry. Think about being able to bend over and pull the laundry out or pull dishes out of a rack. And these folks will work with patients usually one-on-one in a therapy gym or maybe in a patient room. But this is an exciting field. Take a look at the job potential for this as well. The median pay for an occupational therapy assistant. Now I need to clarify this. This is occupational therapist, the full therapist. That is a master's degree program if you want to become an OT. An OTA is the assistant for an occupational therapist that works with the occupational therapist. But the OTA is the one that primarily does a lot of the treatments. The occupational therapist does a lot of documentation, the plan of treatment, and they do treatments as well. But the OTA is the one that gets their hands on with that patient and getting them to their functional capacity. So you can see here about $57,000 a year median pay. This is average coming out of school. Look at this job growth, 31%. They've been growing quite a bit, and that's nationally and within our counties. Now, alongside occupational therapy, which you all have heard of, is physical therapy. Physical therapy is, again, we'll take the patient who had the hip surgery. They're focused on ambulation primarily, on being able to walk, on their gait, on how they move their feet, on being able to physically do other things. The occupational therapy, that's very tactile. They're being able to do the activities of daily living. This is just that full functional capacity. It's very musculoskeletal involved. And again, they work in the same kind of setting, usually a rehabilitation center, a clinic, and a hospital, and long-term care, and assisted living, and any of these areas that have, or an outpatient setting, any of these areas that have therapy. Now, again, the PTA, just like I mentioned with the OTA, this is not the physical therapist. This is the physical therapy assistant. They're the ones that are doing a lot of the hands-on treatment, while the PT is doing the plan of care and the treatment of that kind of thing. Now, for a physical therapist, that's a doctorate program. This is an associate's degree, an AS degree, as is OTA. But I've seen a lot of folks in my career who have started out as OTAs, PTAs, who have decided, I want to go on, I want to keep going. That's the beauty of these health careers, is that you get in, you start your education, and you can get in and get working with just a few years of school, but then you can go on from there. Job outlook, just the same as what I said for OTA, close to 50,000 a year. Again, 26% job growth. They're doing quite well as well. Next is radiography. Radiography. This program is all about the radiological sciences, being able, X-rays. These folks work in the hospital setting primarily, or they work in medical offices. and they're working with patients to get these radiographs and get these examinations. Job outlook is quite good for these folks as well. You're seeing $61,000 a year on average for them. 9% job growth, still faster than average. I mean, after you just see the 31% and the 26%, I know that seems small, but still, all of these careers are growing faster than average. Healthcare is interesting. I've said for years that this was an area that is going to be constantly growing and will not be affected by economic downturn. Now, I never thought in a million years that a pandemic would in any way affect that. I know you all have heard that there's been some health systems that have done furloughs. Advent has not done that. This is a very unique situation, but I will say that healthcare, for the most part, is still pretty insulated, and still there's always going to be a need and always going to be job opportunities for those folks. Next is respiratory care or respiratory therapy. This goes right along with that group of therapists that I often mention. During COVID-19, respiratory therapy, I think, has gotten a lot of attention that it always should have had in the first place. But it's been respiratory therapists that have been primarily working with patients on ventilators and on receiving any kind of medical gases or aerosols or anything to do with the lungs, that pulmonary system. These folks have been absolutely critical during all of this and in working with the patient population. Please take a look at this video. This will give you even more information about RTs and what they do and what this program is like. Again, you see the median pay for these folks from 2018 is right on par with the rest of them, and you can see that the job growth is much faster than normal as well. I do want to say, as I'm thinking about this just occurred to me. All of these health careers, you all can imagine that these are rigorous programs. And they need to be. These are not. I mean, these programs are student-centered, and we will help you be successful. But they are limited access. We are looking for candidates who have good work ethic and who have a strong academic background, because none of you want to be treated by a respiratory therapist or a nurse or an OTA or a PTA who just kind of glided through school. You want the most competent and skilled professional that you can possibly have working on you or somebody that you love. So that's why these programs are rigorous. They're science-based and they can be intense, but you want them to be. You want that challenge to be able to work in the healthcare field, and you can do this. You all can do hard things, and this is something you can do. Okay, surgical technology. This is a great one. A lot of people don't realize what this is either. They watch a show about an ED or a surgery room or an OR, and they think that everybody that's working around that patient is a nurse. They're not. If you particularly like the idea of surgery and operating rooms, and you like watching those surgery shows, and this is the program for you. Now I will admit that. The blood and guts I wouldn't have made it very far. But if you like anatomy and physiology and you enjoy that setting, this is what you want to do. This program is all about having the technical ability and skills and knowledge to work with a surgical team, being able to suture, being able to identify medical instruments, being able to go through safe protocols for surgeries, and this is again a fast-paced, fantastic field. Take a look at this for them as well. That this is an AS degree, about a 2-year program for median pay $47,000 a year. Again, a 9% growth as well. This program is in demand as well. Okay, now those were our associate degrees. Now these next couple of programs I want to show you, there are certificate programs. They're shorter in length. They're considered a vocational program. And so they require less time, but the payoff is great for these as well. Massage therapy is in high demand. In fact, our area is we're producing fewer massage therapists than the area is demanding. It's a 750-hour vocational program. It takes about 2 semesters or a year to complete. So this program really gets into the anatomy and physiology of massage. And you think, a lot of people times we think about the European, the Swedish massage, where you go into an area, or like I don't know, like on a cruise ship or something like that. There's components of that, but what this is a health-related program. Really, it's getting in more into the health benefits. I don't know if you all have been to a chiropractor at any time, but a lot of chiropractors now have massage therapists working with them to work out the spinal area before the chiropractor does their alignment or their adjustment. Or you'll see a lot of massage therapy clinics that are independently run. There's definitely that aspect of relaxation and the Swedish side, but it's more geared toward the health related benefits of this, more of a holistic approach to healthcare. And look at this, and look how, $41,000 a year on average for this program, 22% national growth, which is much faster. And I think this is a lot of this health trend we see towards more naturalistic, more holistic approaches to healthcare, and massage is definitely one of those sciences. Medical code or biller. This is, I mentioned earlier, health information technology. This is actually the first year of medical code or of health information. These are the folks that are able to go in and look at the medical record, code them according to their ICD code or their CPT code to ensure that bills are generated appropriately. And there's actually a large employer here in Daytona Beach. Who pulls on these folks. Now, this is the first year of the program, and you can go on and be employed with this through the certificate, but it's a great idea to go on to the AS degree and complete the Health Information Technology program. That'll give you the opportunity to work in hospital settings and other settings as well. So, and this is that goes along the same, I don't need to show you their job growth because it's the same as Health Information Technology. Now, medical assisting, again, this is another one of those that are probably mistaken for nurses frequently. Medical assisting, these are the folks that when you go into the doctor's office who will take your vitals, who will do a brief history and physical. They're able to do EKGs and do injections and things like that. They are typically the ones that do the intake of the patient before the physician actually sees that patient. So everyone thinks that's a nurse, and in some cases it is. Sometimes you see an RN or an LPN. But a lot of times it's a medical assistant who has that, who they've been trained in that. So anatomy, physiology, code, there's some coding that goes on there as well for these folks, just like I mentioned with medical coder biller, because sometimes these folks also do some of the business aspects of the physician office. This is a great way to work in a family practice or a physician practice, something of that nature if you have an interest in that. So the job outlook for these folks, they do quite well as well. For a few semesters of school, they're coming out making around $33,000 a year. Again, 23% job growth. Again, that's just healthcare. There's just a great potential for job growth here. And last, for the certificates here, phlebotomy. These are the folks that will draw blood. You'll see these folks in hospitals. They work for Halifax. They work for Advent. They work for doctors' offices. They work for independent companies who go around taking blood samples from folks in other subacute settings. They definitely need to not be afraid of blood on this one. But this is an 8-week program, and we offer this a few times a year. And phlebotomists do quite well for just a few weeks of training. They can come out making around $35,000 a year. Again, 23% job growth. Again, I would encourage you to go back and look at some of these videos if you have any interest in these. It helps me to see a visual of what each of these actually are. Okay, moving on to the School of Dental Sciences. So we've covered nursing, the School of Nursing, the School of Health Careers. Now to the School of Dental Sciences. We have 2 programs that you'll see in the School of Dental Sciences, Dental Assisting and Dental Hygiene. They are different programs. So Dental Assisting is a 1-year certificate program. This is, you see a lot of the same functions between hygiene and assisting, though hygienists are credentialed to do a lot more of the debridement in the oral cavity and on the gums and do periodontal care. But they assist the dentist chair side, take X-rays, do that kind of thing. A lot of times the folks that you see in the dental office are dental assistants, and you can see with dental assisting with a year program around $38,000 a year and an 11% job growth. Now, my understanding of dental assisting is that a lot of times these folks will find part-time jobs. A lot of dental offices will hire part-time, and sometimes they find multiple jobs to fill in that. But again, please take a look at the video for more information on that. And then dental hygiene. This is a 2-year AS degree. It's actually 88 credits, so it's probably a little bit more. I mean, when you put it in time frame, it's probably a little bit more than 2 years, but that's how we break the program down. This gets into this debridement of the gun line and the periodontal care, and these folks are credentialed to do quite a bit more, and they're also compensated along those lines. If you see this dental hygienist, the median pay is about $74,000 a year. Now, sometimes these folks will end up working a couple of part-time jobs as well, or they'll be able to work full-time in a dental office, and then their job growth is about 11%. So they're growing quite well also. Okay, last I want to talk about the School of Emergency Services. There's a couple of programs in here that are public service related, like correctional officer and police. We have a police academy, Florida Department of Law Enforcement, which are just absolutely fantastic. But I want to focus primarily on our health related programs. So I would like to show you, I'm going to go through a couple of these quickly. I would like to show you our EMS, our EMT, Emergency Medical Technician. The EMT is a 1-semester technical diploma. We have day and evening classes available, and in this you learn to render emergency medical assistance. Now, in Florida, if you want to be a firefighter, EMT is part of this. It's interesting. Last year in Volusia County, there were over, I think, 40,000 calls. And only 4 or 5 of them, the firefighters actually had to use a hose. There just aren't as many fires as there used to be. I guess it's the construction of the building or the fire safety codes that we've got. Firefighting, interestingly enough, is becoming more of a health-related field. In fact, anytime there's anyone calls 911 for an ambulance, a lot of times you'll see the fire truck there because they're trained in the same way. So EMT is, you can definitely finish with just the EMT for that 1 semester, but we encourage our folks to go on to what's next, a 4-semester paramedic program. This means that you're licensed to do a lot more things cardiovascular, cardiopulmonary related. We also have flexible schedules, hybrid classes. You learn advanced emergency and pre-hospital care. And then you can cap it off with an AS degree. So it's really a 2-year program altogether. You could do the one semester EMT and go and be employed with that. We would encourage you to continue on and do the paramedic, and then once you've done those 4 semesters, you might as well finish another semester and finish the AS degree. But you're employable in any of those settings, and you can do quite well. So if you take a look at this EMT. Again, about $34,000 a year, 7% job growth, so faster than average. There's definitely growth and opportunities there. Firefighter, the same thing that I had mentioned before, although you can see that firefighters, their median pay is a little different as well. And I should note that a lot of these folks go on and they work for a county or in a government setting. And you may not be thinking about this now, but as a government employee, these firefighters get great pensions, as do the police officers. And while they may make some sacrifices in pay during their career, they definitely do quite well in retirement. Okay, ladies and gentlemen, that finishes my presentation. Again, this is just an exciting time to be in healthcare. The opportunities are limitless. I loved being in healthcare. And I forgot to mention that my career, as I started out in health administration, I was a long-term care administrator. I was a CEO of long-term care facilities, and I loved that opportunity to do something meaningful every day. And that's exactly what this offers. It offers good employment. It offers the opportunity to make a meaningful difference in the community, and something that you can feel very proud of. And again, this is just an awesome time to be in the field. All right, thank you, and I think we'll open it up for questions.
So for our guests, at the bottom of your screen, you probably see a tab that says Q&A. It's a white tab. If you click on that, then you will be able to see the questions to follow along with us and type in your question. And while we're giving it just a moment for some questions to come in, I do want to remind you that our Future Falcons webinar series, our next one is tomorrow, Thursday, May 21st at 10 a.m. that will be Daytona State Next Steps. So what happens after you submit your application? And then you can also see the full webinar series at daytonastate.edu/admissions/webinars. And it looks like we have some questions starting to come in. So let's give this just a moment.
While those questions are coming in, I mentioned the Bureau of Labor Statistics website. I'm going to see if I can, am I able to put this in the chat at all there, Ms. Sanders? I think I'd like to put the website in here somewhere.
I will figure out how to do that.
It's literally just bls.gov, and you can go in and type in the profession. I really suggest it for y'all to take a look at it. For me, it helps to get a visual, and it's very forward. It doesn't romanticize healthcare. Healthcare is a tough field. Just as you guys are thinking about this, it's extremely rewarding, but it's hard work. You're dealing with a lot of emotional things. It's physically demanding, emotionally demanding, mentally demanding, but it's an awesome field. Thank you, Mr. Thomas, for getting that up there. That's www.bls.gov. So Beth Hoodeman asked, how do I apply for one of these programs? So each of these programs are limited access, and don't be scared by that. That doesn't mean that folks aren't getting in. What it means is that we either our accrediting bodies dictate how many students we can have for however many instructors, or we're looking at the market, and we don't want to flood the market. So to apply for these programs, you need to go to each individual program's website. And if you look at daytonastate.edu, we have an excellent website for each of these programs. You can look and see what the prerequisites are for each of them, prerequisites or co-requisites, and that will tell you how to apply for each of these. All of the applications do come in through our advisor, and we have different application windows for each of these. So Desiree, it looks like, is the opticianry program only offered at one campus? Yes. So that program is offered here on the Daytona Beach main campus. It's in Building 320. We have a beautiful lab and beautiful teaching space with brand new equipment. All of the things that you would see at a lens crafter's or in an optician's office, and you learn how to use each one of these pieces of equipment and how to fashion. I think I mentioned you actually fashion lenses, you fashion eyewear. It's really a cool program.
All right, are there any other questions? Well, in that case, again, we want to thank you so much, Dr. Chesley, for joining us today, and for our guests who joined. We appreciate it very much. We hope to see you at some future Falcon webinars going forward. And please don't ever hesitate to give us a call if we can be of any assistance. We are working remotely, but we are available to help you. So have a great day.
Thank you. I'll have a great day.